Okay, so now we've already examined you and we know what procedure we're going to do. So let's come on down to the OR. And here we have our champ. He's going to have his procedure done. Let's head on down. Everyone always gets nervous at this part, but this is nothing. Let's meet the rest of the OR staff. And here's our OR. Well, there's our X-ray tech. Hey, Jocelyn.
Hey, doctor.
What do you do, Jocelyn?
I take X-rays and I assist you with what you need to see during your injections.
You know, that's really important. Okay. And here we got the man of the hour. Frank is going to be setting up the procedure. Don't let the needles scare you because it's really all part of it, okay? All right. And
my name is Virginia. I'm going to give you a today.
Virginia is going to be our anesthesiologist. Now that's super important because she makes everything really comfortable. And you're not going to come back just for the anesthesia. Remember that. Okay, we're going to get you in position.
You're going to put your head over here. What's the idea?
Your face can be over here.
Now this particular procedure we're doing was called a cervical epidural steroid injection. And we're going to position. And that's really all there is to it. Little pillow under the chest. We're going to flex down. And we're going to hook up all these monitors. Now all these monitors, blood pressure like we talked about, a pulse oximeter, and heart rate monitors, and some oxygen. Okay, so Virginia is going to set all of this up. In the meantime, Jocelyn's going to show us her C-arm.
Yep, this is my monitor. I'll be putting the patient information soon enough. And this is my C-arm. I move it left, right, every angle you need to, any angle.
What's your idea?
Fantastic. Okay, so now you know it's the second time, or when you do actually come out here, it's nothing. So we look forward to taking care of you, and thanks for putting your trust in us. So Jocelyn's going to get in position because what I want to do is I want to be able to see the cervical spine. This way, as I'm going into position between the cervical bones, I can be very accurate. We're going to use a betadine preparation, which kills all the bacteria and keeps things clean. And you'll see Frank has set up over there the entire kit, and everything is sterile, everything is clean, and everything is single use only. Now, typically we do the prep 3 times. Why 3? I have no idea, but it's a good enough number.
CRNA, and I'm monitoring his blood pressure, his EKG, and his pulse, and I gave him an oxygen cannula. And I gave him a little Versed.
So Virginia is going to make sure he's safe because traditionally what we do is we have one separate physician just taking care of the patient. It's kind of like a pilot. He just flies the plane. I'm going to serve the drinks.
How you doing? I'm Alan, the circulator nurse in this room right now. So my job is really to keep the patient safe. I manage the flow of the procedures and also make sure that we have a safe environment and also a sterile environment.
So it's really important. Alan is also going to be doing a timeout. We're going to say the patient's name, allergies, what procedure we're doing. We've all already introduced ourselves, which is important. And so we're all on the same page.
Okay, so this is timeout here.
For privacy, we're just going to use the name John Roy, date of birth, December 25th.
And he has no known allergies. And what we're working on today is the cervical epidural steroid injection.
We all concur.
All agree.
Agree.
All 2?
Agreed. And that's
Agree? Agree?
Agree.
we're going to get started. All right. I call this it's a swivel stick. Helps me identify where I'm going to go. Everybody covered? Covered. Virginia, may we proceed?
Yes.
So I found a good location where I'm going to go. You can feel just a very gentle pinch. You know, the secret of really giving local anesthesia, take your time. There's no rush. You're doing great, okay? That's good. Just relax your neck. You're doing fantastic. What I like to do is put a little bend in the needle. It just helps identify this better. You can see Jocelyn has coned the picture down for me, so it's not radiation everywhere.
A lot.
Great. Just very gentle pressure. Good. Just relax your head into this. I'm touching the bone because now I know my depth, so I'm going to gently slide off. I have a little syringe full of water, and I'm going to push this into the needle until it gives. You're doing great, okay? See, I have resistance here. A little bubble of resistance. I'm just going to gently go inside. Chest on position. Looks good. You're doing great. Voila. So now, I'm going to use some contrast. It's X-ray ink. We want to see where we're going. So if we can look up on the screen, we're going to see the ink spreading. Perfect.
See.
This is our steroid with a little bit of water. I'm going to make sure that he's okay. You okay? Wonderful. You're doing fantastic. And now we're going to save that picture.
See.
Thank you. And I'm just putting a little bit of medicine up here. And the contrast has kind of drifted right off to the side by the nerve roots. That's great. That's what we want. We're done. I'm going to pull the needle back. I'm out of the epidural space. I'm just going to aspirate and take it out. We are done. We're done. Fantastic. And that's really all it is. Most patients don't even remember having this done. It's a little bit of midazolam, and they don't even remember. But we'll see him in the recovery room, and we'll follow up in a couple of weeks and see how he's going.
What's the matter? Finish.
Simple and straightforward, but you know that for me it was. How did you feel?
It was good. It was good.
Did you have any pain during the procedure?
No.
Well, that was good. So he was out, yes, but it's with my Dazzlam. So I'm still able to talk to him because remember, the safety of doing these cervical epidural steroid injections is communications. So I'm going to check your Band-Aid. And okay, that looks good. And the ginger ale is okay.
Oh, ginger ale is important.
And what I always like to do is I always like to do a quick neurological test. Squeeze my hand really hard. Ah! Just kidding. All right, hold on to this side. Squeeze my hand. Good. Neurologically.
Hey, man.
All right. So there you have it. We've walked you through from the coming into the surgical suite all the way through the procedure. You saw the procedure, and this is it. So again, thanks for putting your trust in us, and we look forward to seeing you.
I'll take that.